Hi, this is Lexus Bill, host of Drive Time on Joy 99.7 FM. Listen, you don't have to worry if you miss Drive Time or Personality Profile. It's going to be live on our podcast page. Just log on to www.myjoyonline.com/podcast. You can listen to Drive Time, Personality Profile, and any other of your favorite shows on Joy FM on that page. You don't have to miss a show at all. Joy 99.7 FM, radio for discerning listeners. All right, so let's get on with our COVID-19 conversation now and the ongoing rollout of the AstraZeneca vaccine, the second dose. The Ashanti region is recording low numbers. Is it a case of vaccine hesitancy, apathy, or the last-minute syndrome that's typical of Ghanaians? Let's hear from the Deputy Regional Director of Health, Dr. Roxing Michael AJ. Good morning to you, Dr. Michael AJ.
Good morning, and good morning to your viewers.
All right. So we'll be coming to you in a bit, but Ohiming Teria has also been monitoring the situation, and he's joining us via Zoom. Good morning to you, Ohiming.
Good morning, Israel.
Yes, so before we get into the COVID-19, I'd want to find out what the rain situation is like in Kumasi.
Yes, Israel, it's been raining in Kumasi since dawn. And I must say, some places are flooded. For instance, the main Kumasi Accra route, the Pamo Tech Junction stretch of the road is flooded. This means that motorists have to devise a strategy themselves. Now, what motorists have done is to convert the double lane, the Kumasi, Accra direction part of the route is blocked. So what they are doing now is the Kumasi, Accra part direction of the route being converted into a single lane. So drivers who are traveling from Accra to Kumasi have to join their counterparts or share the other side of the road with those who are traveling from Kumasi to Accra. Hitherto, it was a dual, carriage road, which means that you don't meet vehicles when you are traveling on the either side. So that has been the situation. And the vehicle you see in the picture is actually stuck in the flood waters. And when I tried getting some of the visuals, I heard the driver asking me not to do that, indicating that indeed he's in the vehicle. But I actually asked him to get out of the vehicle since it was early days yet and the floods has already started. So that is the situation that we find ourselves in Kumasi. And I'm also learning that other parts of the Kumasi metropolis, especially from the Bekwai roundabout section of the road to Santasi roundabout, in between the South Junction, as it's popularly known as, is also flooded. And this is not the only places that are flooded, but we continue to monitor the situation in the region and then receive reports from other parts of Kumasi because of on the floods.
All right, thank you very much, Ohiming. I'd also want to believe that as a result, we're expecting that the traffic situation is going to get worse in the city.
Yes, it is likely to get worse, but uncommon of the usual traffic that characterize the Tech Junction Doom stretch today is missing, probably because it has been raining and maybe many motorists are not on the road now. But we are likely to have the traffic situation negatively impacted as vehicles continue to flood the city center.
But on this particular road that you're talking about that is heading out of the city on the main Accra, onto the main Kumasi, the highway, that clearly will be affected, right?
Sure, it will be affected, but by the time I got to the scene, that is when the floods has started. So the indication is that as many vehicles continue to make their way on the single lane, then traffic will be definitely affected.
All right.
Definitely, there will be slow movement of vehicles in there. because if you look at the volume of vehicles that fly the Kumasi-Accra route, is very, very, very huge.
Yeah.
And if these lanes, the 4 lanes, being converted, only 2 are available now, then you can imagine the pressure that it will bring on the road.
Sure. All right, so I mean, let's talk about COVID-19. You have been monitoring the vaccine rollout of the second dose, and the initial report that you had yesterday suggested that people were not so keen on it. Has the situation improved, or do you have any answers as to why this is happening?
Unfortunately, the answers, there has been mixed reaction, especially from health officials, as to why many people are not keenly, finding themselves at the vaccination centers. One of the reasons that health authorities gave is the fact that this is not open like the Johnson & Johnson vaccination exercise, where a lot of people trooped in. But this one is more or less reserved for those who have had the first dose of the AstraZeneca vaccine. But even then, they expect that the numbers will be huge because the number of vaccines that we have in the region or allocated to the region is not that enough. If you look at the numbers, we are looking at 70,300. And if you compare the 70,300 to the 110,189 people who have partially been vaccinated, then it means we still have a backlog of about 39,000 people who will need a vaccine. And so, yes, the numbers are not huge. And for instance, at the Menchia Government Hospital, I was told that when the exercise started on Tuesday, though they were scheduled to officially start the exercise on Wednesday, that's yesterday, they themselves, health officials made themselves available and arranged for residents to be vaccinated. So a lot of people gathered there, and they tell me the number of people that they received was so huge that the queues had to be extended to outside the premises of the hospital. And the unfortunate thing is that they had issue with the tablets. They have apps that they use to, get details of individuals who come for the exercise.
Yeah.
And this, when you go, they have to cross-check and then find out whether you are part of the people who are supposed to be vaccinated. But unfortunately, there was an issue with the app on the tablet. So they couldn't vaccinate the people. Fast forward, on Wednesday, this same number of people did not turn up because probably the people experienced some challenges on Tuesday. They decided not to turn up on Wednesday. Though the numbers, I must say, as a journalist, when I went there, I said, this is encouraging. But the health official told me, if you had been here yesterday, then you wouldn't be talking about the figures that we have today. And it's not only Menchia Government Hospital. Other places that I went, the Church of Christ Clinic Vaccination Center, for instance, a few people were there, and the municipal health director told me, yes, it's been a slow start. So he expects that as the exercise moves on day by day, then many more people will join the exercise. For instance, if you go to Suntresu Government Hospital, it's one of the centers noted for huge numbers. There too, the numbers were, for me as a journalist, I would say the people were there, but then the medical superintendent tells me, yes, they expected the slow start. They were not, they've not been some sort of expecting a huge people to gather there because of the nature of this particular exercise. But nonetheless, health officials believe that the region can do better than what we are doing now. If you compare the figures to what we had for the Johnson & Johnson, and for instance, the first, exercise that these people got themselves, they received the first dose, then they expect that the numbers will go up than this. But Israel, let me give you this clear picture. In Ashanti region, what we've been told by health officials is that if you look at the entire region, we've had 327,789 people receiving vaccination in general. And then if you look at those who are fully vaccinated, the figures is just about 217,602. And we have, out of the 217,000, we still have people who have partially received or partially vaccinated, 110,000. 184. So what it means is that even if we are to give all these people the current dose that we have, we are talking about 70,300. So indication is that we still have a backlog of 39,884 if we vaccinate all the 11,000 with all the vaccines that we have currently in the region.
Yeah.
But don't forget, the region also has in excess of 4 million people. So in terms of vaccine and ratio for the population, is very, very, very minimal.
All right. So it's true, Heming, but yes, the situation is no different here in Accra, where yes, a significant number of people who are waiting for their second dose, but we don't have all that, or Ghana doesn't have enough for everybody to be fully vaccinated. But they're working on that, I believe. And as we've heard from the presidency, 1.5 million extra doses of AstraZeneca coming into the country. And so that could be taken care of. But fortunately, we have with us the Deputy Regional Director of Health, Dr. Roxing Michael Ejay. So he's going to be speaking to all of that. Thank you very much once again, Dr. Michael Ejay. So what actually is happening in the Ashanti region as far as the rollout of the second dose of the AstraZeneca is concerned? Is it vaccine apathy, or people are just hesitating, or just the last minute thing?
Thank you very much. And once again, good morning to the viewers and listeners. Yes, the first day of the campaign was characterized by an apparent hesitancy. I use the word apparent because it wasn't from the demand side. It was actually from the supply side. People were queued at the various centers, and vaccines were available, but they were not accessible because of challenges we had with the app we were using to collect and also register vaccinees. So out of that, many became discouraged after waiting for several hours in the queues, and they had to return home. And obviously, an unsatisfied client would definitely tell others that the exercise has not started, and people wouldn't want to get frustrated by coming to queue for nothing. Thankfully, we're able to resolve these technical issues yesterday around 10 a.m. So the exercise continued, and people started turning up in their numbers. Obviously, the news has now gone by, so we expect people to queue up in our centers today, barring the rains we're experiencing this morning. But let me say that in the midst of all these challenges, some districts were able to exhaust their doses yesterday.
Okay, all right.
And they even need more to be sent, and we are doing some reallocation to them today. Yeah.
All right. So for those of you who are watching us, and those of you in the Ashanti region, as we've heard Dr. Michael Ejay saying, the issues with the app have been resolved, and so go out there once the rain subside and go get your jabs. Some areas, as he's indicating, have exhausted their doses, and so they're expecting to get some more. But let's go out there, let's get the vaccines, because as it is now, it is one of the things we need to do to ensure that we get ahead of the COVID-19 pandemic as it is. This virus, the Delta variant especially, is quite troubling. And so let's work towards that. Now, Dr. Michael Ejay, one of the other issues that we have to look at is, what are the people supposed to do? As it is now, they're told to go to where they took their first jab. Can it be arranged that you could go anywhere, since it is centralized, so that if you fall within the allocation, the people who are supposed to come for their jabs, you can probably walk into any facility in the Ashanti region?
Yes, that's a possibility, though we expect people to go back to their vaccination points. If it's not convenient for you, you can turn up at any point with your card and also an ID card. And when you get there, they can key your details into the system, and then your first dose details will pop up, and they can go ahead to do the second dose for you.
Now, for purposes of clarity, can you once again state the period where for the people who have been vaccinated, who are due to get their second dose, it's supposed to fall within a certain time frame?
Yes, anyone who had his or her first dose on the 10th to 29th March 2021 is due to take this second dose.
Now, there were those two who probably didn't have it or couldn't make themselves available when the second dose started, the first phase of the second dose started. Can they go back, as in those who were before the 10th of March?
Yes, they can go back, but there's a caveat here in that these vaccines have been reserved for the category I just mentioned. But if you couldn't get your second dose in the first set that we did, that's from 2nd to 9th,
yeah,
you can go there. The team can arrange to get you vaccinated, but you need to be a bit patient.
All right. And as Ohimi was indicating, there are many more people who are due for their second dose, but we don't have enough vaccines around. So if you could give them some assurance that that is also being taken care of. Of course, we have more coming on the way.
Definitely. We've made arrangements. We've already started making plans to have these group vaccinated, because we've equally received word that some doses of AstraZeneca is coming in. So we know in the coming days, they will also get the opportunity to have their second dose. So they should be assured and not panic at all.
And then again, let's use the opportunity to educate the people who may, well, for one reason or the other, want to stay away from the vaccination because they say the vaccines are unsafe. I know that the Director General of the Ghana Health Service has been speaking to this, but once we have you on the line, you could also speak to that and assure the people that these vaccines are safe.
Yes, rightly so. There have been a lot of myth or videos circulating about safety of the vaccines, and I have to assure the public that all of us leading the charge against COVID-19 have equally vaccinated. I had my second jab yesterday, and you know that myth that the vaccine contains some magnetic substance. We have investigated in Ashanti region, and we have some findings for the public. There is no truth in it. We have experimented, even got some of those people who claim their phone stuck. We got them and then we took them through some routines, and then the phone did not stick. So let's be assured the vaccine is safe. It is meant to protect us from severe disease and also prevent death. And furthermore, we've had analysis of our own local data looking at the effectiveness of the vaccine, and it's proven beyond doubt that this vaccine actually saves lives, because the deaths we've had in Ashanti region, analyzing them by their vaccination status, it was clear that persons who did vaccinate had a reduced chance of death by 76%, and this is consistent with what the manufacturer put out. So it is safe. Adverse events we've had in the region since the vaccination exercise started in March, we've had less than 3,000 reports, and this is mainly non-serious. That's minor complaints people may have, headache, fever, and we had just 3 serious adverse events, which we investigated and gone through and found out that they were mere coincidence. So there's no doubt that the vaccines are safe, and we admonish everyone to go out and get vaccinated for their protection, also protection of the entire community.
Right, thank you very much, Dr. Roxing Michael Ejem. For those of you who are saying that, I mean, the bit about people saying their phones are sticking to them and all of that, yeah, really, I'm not sure that's actually true. And for purposes of demonstration, I've actually taken my phone. I'm going to stick it to my side to see if it's going to stick. As it is, it's falling. Or if, well, let's try this other side too and see if it's going to stick. It's not sticking. And I've had my 2 jabs, so please, go out there to take the jabs. And maybe before you go, let's also make the point that the fact that you've taken your jab does not mean, or you've been fully vaccinated, does not mean that you should go about and throw caution to the wind and take off your mask. The mask still has to be up, right, Dr. Michael Ejem?
Certainly so. And I will still go back on the research we conducted on infection among persons who are taking the jab and those who hadn't. This was done somewhere in May. We did analysis of our local data, and we found out that persons who are taking at least one jab were getting infected, but they were not getting the disease. And what we found out was that they threw caution to the wind because people thought that, oh, once I'm vaccinated, I can go about my activity anyhow I please. But let's know that the vaccine prevents disease and reduces the risk of death. But infection only occurs when you get yourself exposed. That is when you breach the protocols. So don't get infected for your immune system to now fight the disease with the help of the jab. Let's prevent infection, and then we can also prevent getting disease, whether you are vaccinated or not vaccinated.
Dr. Roxing Michael Ejay, the Deputy Regional Director of Health of the Ghana Health Service. And then also to you, Ohimingtua, for joining us to give us all those insights. And I'm sure you'll be monitoring the rain in Kumasi for us so that we can get some more updates later, as well as the rollout of the second dose of the COVID-19 AstraZeneca vaccines. Thank you to you both and have a wonderful day. You're still here on the AM show. We're taking a break and we're bringing you showbiz right after that. To stay tuned in.